Hello, my name's Davida and I'm a paediatric consultant. This is Corinna, she's a paediatric diabetes nurse specialist, and today we're going to talk a little bit about insulin pump therapy for children and young people with type 1 diabetes. Insulin pump therapy has been used to manage children and young people with type 1 diabetes for several years. Can you explain to us why insulin pump therapy is different from using insulin by injection?
Yes. An insulin pump is a small battery-operated device that is filled with rapid-acting insulin. The person wearing the pump needs to be connected to it all the time throughout the day and night, as the pump is programmed to deliver a small amount of insulin continuously.
So how does the insulin get from the pump into the person wearing the pump?
The insulin is delivered via a small cannula that is usually situated on the person in the same places where they would give their insulin injections. The cannula needs to be changed every 2 or 3 days, and the wearer will be taught by their healthcare team how to do this.
So how does that insulin then get used in the same way as an insulin injection might at mealtime, for example?
When you're connected to the insulin pump, you are taught how to program your pump to deliver extra doses of insulin called boluses at meal times. You will also program your pump to deliver extra doses of insulin when your blood sugar levels are high.
So I've had many discussions with families in my clinic who are thinking about perhaps swapping to an insulin pump. Can you explain why someone would actually want to swap to an insulin pump?
There are many reasons why families might choose moving to an insulin pump. Certain insulin treatment options using injection pens can be found quite restrictive, as people need to stick to strict meal times and snack times. When you're wearing an insulin pump, you can more easily match your insulin with your meal times when you choose to eat, and your diabetes team will guide you on how to do this.
That sounds quite a lot like the multiple daily injection regimes that many young people are currently using to manage their diabetes. Why would you actually want to be connected to a pump when you can do the same with insulin injections?
Not everybody would like the idea of being connected to a device all the time, so an insulin pump wouldn't be right for everybody. However, I know many families with children who are happily wearing insulin pumps and enjoy the freedom of being able to press a few buttons to get a dose of insulin, rather than having to dial up yet another dose of insulin and put the needle into the skin to have 4, 5 or 6 injections of insulin every day.
Have you got any pumps that you could show us, please?
Yes, I bought some pumps to show you. The first pump I'd like to show you, I've connected up to Rufus the Bear from JDRF. This pump is connected to the cannula via a short section of tubing. The wearer uses their handset, which is also a blood glucose machine, to control the pump. You can use the handset to ask the pump to deliver bolus doses of insulin at mealtime and to set your basal rate, your background insulin.
And where would someone actually put the pump itself?
The pump can have a clip put on the back of it so the pump wearer can connect it to their clothing, or you can put it in your pocket, or there are special pump pouches that you can get and you can hide the pump discreetly away in a pump pouch. This next one is slightly different. This is a tubeless system. So here the pump wearer wears a patch pump which is directly filled with insulin and needs to be changed every 3 days. Like with the other one, you have a handset which is also a blood glucose machine, and you control the patch pump using your handset. And this last one I'd like to show you, very much like the first one in as much that the pump is connected to the cannula with a short section of tubing. This system, you can also use a continuous glucose sensor which monitors your glucose levels and wirelessly transmits the information to the display on the pump, so you can keep track of your glucose levels at the same time as you're keeping track of your insulin infusion.
So can anybody have an insulin pump?
If you're interested in finding out more about insulin pump therapy, you should speak to your local diabetes team, and they will tell you how you go about getting an insulin pump, but they will be guided by government guidance as to who and when people can access insulin pump therapy. What I would say is that if you are considering swapping to an insulin pump, that the timing of the swap is crucial for success. Anybody who is going to be supporting the child or young person in managing their insulin pump needs to be fully trained. So school teachers will need to be supported, and any other adults, parents, grandparents, everybody needs to receive the training for it to be successful.
So there are lots of potential benefits from having an insulin pump, but are there any drawbacks?
Because the insulin pump is a piece of machinery, there are occasions when it might stop working. If that does happen, all pump wearers are required to keep insulin injections as a backup at home so that they can switch back to injection therapy whilst they're waiting for a new insulin pump to be delivered. And in my experience, insulin pump companies are very, very swift at getting new equipment out to families, so you won't need to be off your insulin pump for long.
And if there's anybody watching this who is interested in switching maybe to an insulin pump, what's the next step for them?
I would recommend that they go and speak to their local diabetes healthcare team, who will talk them through how they move from taking insulin injections to swapping to an insulin pump, if that is in fact the right treatment for them.
Thank you, Corinna. So there are lots of different insulin pumps that are available, and Corinna has outlined some of the potential benefits to switching to insulin pump therapy. If you are interested, as Corinna mentioned, please contact your local diabetes team.